Pregnancy is a very important time in a woman's life, but it's also very stressful. Everybody wants what's best for the mother as well as the baby. What can you do to ensure that your pregnancy is safe? There are two diseases which you need to consider before planning a pregnancy. One of them is diabetes mellitus and the other is a thyroid disease. There has been a huge increase in the number of diabetics in our country, and we are second only to China in the number of diabetics in our country. Unfortunately, diabetes is being diagnosed at much earlier ages, sometimes in the late 20s and the early 30s. There's also been a change in the age when women get married. We are getting married later and we're planning pregnancies much later. So it may be possible that you're already diabetic or pre-diabetic by the time you plan your pregnancy. Once you get pregnant, this diabetes will worsen. So it's very important, one, to screen yourself for diabetes prior to planning pregnancy with a test which is called an HbA1c or a glycosylated hemoglobin. Please see your endocrinologist with this report and make sure that you have good control over your diabetes prior to planning your pregnancy. High blood sugars in the first few months of pregnancy can cause adverse consequences for the baby. This is the time that the baby's organs are being developed, and if the sugars are high, it can cause serious brain, heart or spine defects in the baby. During the pregnancy, in the early part, if the sugars are high, it can cause an increased risk of miscarriages, while in the later part of pregnancy, there can be an unexplained death of the baby during the pregnancy itself. Screening for diabetes as well as controlling the sugars adequately during the pregnancy will ensure that you have a healthy baby. This can be done with intense lifestyle modifications, diet modification, regular exercise, and sometimes you may need to take insulin injections to control your blood sugars. The aim of the treatment is that the HbA1c or the glycosylated hemoglobin should be less than 6% to ensure a safe delivery. There's an increase in the incidence of thyroid diseases in women, especially hypothyroidism. If you have untreated, undiagnosed or poorly treated hypothyroidism prior to pregnancy or during your pregnancy, it can have adverse consequences not only for the baby but for the pregnancy also. In the baby, you can have mental retardation and problems with the development of the brain of the baby. For the pregnancy, it can lead to an increased risk of miscarriage, increased risk of bleeding during pregnancy, increased risk of having a high blood pressure or delivering your baby really early. Hypothyroidism in women can be screened with a simple blood test, and if you control your hypothyroidism well prior to getting pregnancy, it ensures that you have a healthy baby. You don't have to worry, thyroid medications are absolutely safe for the baby during the pregnancy.